think this is a really great question, but I think it's too early to be able to put a dollar figure on whether or not healthcare costs are going to go up or go down because of all this. So first off, it's really clear the number of patients presenting for COVID-related illnesses is new, and that's going to have to put a strain on our healthcare system. In particular, the costs associated with ICU beds and critical care beds. Those are all going to have to be factored into this. But the other thing that's happened that is worth mentioning is that because of the public health measures that we've put in, we've actually seen pretty significant changes in terms of what people are presenting at clinics and hospitals for. For example, at this time of the year, we would normally see a lot of cases of influenza here in Hong Kong. However, because of these public health measures, whether it be hand washing or social distancing, we've actually seen a measurable decline in terms of the number of influenza cases. And so in some cases, we've actually seen a decline in utilization of health services. However, I think it's also worth mentioning that the massive shift that's happening in all of our lives right now is probably also influencing other healthcare costs in ways that we may not have been able to predict or fully understand yet. For example, a lot of countries are reporting decreases in car accidents because people aren't going out and driving as much. We've seen increases in rates of mental health issues, and it's unclear what consequences that might have on the health system. We've also seen, for example, people having things like heart attacks and strokes presenting late. And so it's unclear whether or not that's having a positive or negative impact on total healthcare costs because people are not necessarily getting timely care when they need it. And there's other interesting shifts that have been observed, and we haven't been able to fully account for this. For example, in places like China, when the outbreak was at its peak, people were finding new ways of seeking healthcare altogether. For example, we saw a large proportion of services that would normally be delivered in clinics being delivered online through telehealth platforms, and we've seen reports of this happening around the world. And so it's really too soon to say what the overall impact is going to have in terms of total healthcare dollars. I think what is clear is making investments into our health system are critically important at this time. And so not making decisions that are based on limited budgets as opposed to trying to optimize about the new scenario that we're in is really critical at this time.